majority of you on the webinar tonight are turning 65 sometime in the next 8 or 9 months or so, and you've got a lot of questions, and a few things happen when you turn 65, and you're starting to get hit with some advertising. So here we go. Again, my name's Ron Ray, and just tell you a little bit about myself. I've been in this financial services business for about 9 years now. I'm a licensed insurance agent and licensed fiduciary. I hold insurance license in multiple states in the U.S., mainly operate out of Texas. And I'm an SEC registered investment advisor representative, which means I'm registered with the SEC as an investment advisor. And now this is my second career, though. Before that, I've been a police officer for about 20 years. In fact, this coming April, I will complete my 20th year in law enforcement. And but a few years, I decided I wanted to get married and start a family and not have to wear a bulletproof vest to work every day. So I got out of that, and this is what I do now. Now, since I've been in this business, I've only worked with people like you who are turning 65, going into Medicare, getting ready to retire, recently retired. I don't work with people in their 20s and 30s and 40s. And people are still working and raising families and saving money. And I really only work with you. And that's what really allows me to focus my expertise and my efforts on the things that matter to you. And I work in an area called holistic retirement planning. And what that means is I don't just focus on one area of retirement. I don't just focus on health insurance or life insurance or investments. I focus on the whole big picture, and that means health, life and legacy planning, long-term care, which is huge, and retirement income, making sure that you have an income that's going to last you throughout your retirement years. And bottom line is, I help people live happy, healthy, wealthy lives for the rest of their lives. One of the questions that always comes up during these presentations is, Ron, is this going to be a sales pitch? And the short answer to that is no. There's nothing for sale here today. So what I want you to do is sit back, relax, ask questions, and learn. I want you to get to know me, my knowledge, my experience in this industry, and hopefully when the time comes, you'll want to do business with me. And usually when I'm doing this presentation in front of a live audience, everybody just takes a deep breath and just kind of sinks down into their seat and begins listening, and I'll begin the presentation. One thing I forgot to do is I kind of wanted to just give you a little bit of a picture of me. I'm just going to turn on my camera here just for a second, just so you can see me. Hi, that's me. Just going to turn that off now so you don't have to look at my ugly mug the rest of the evening. But that was me. Now, I don't know anything about you folks except for the fact that most of you are 64 years old, going to be turning 65 and going into the world of Medicare. So what are we going to do tonight? Couple of disclaimers. Number one is I'm not making any of this stuff up. It all comes out of this book right here, Choosing a Medigap Policy, a guide to health insurance for people with Medicare. Now, this is a booklet that comes from the government. The information in the book comes from the government. And this is my reference. This is what I use to give you the information that you need in this presentation. Now, the other disclaimer is that by the end of this presentation, you may feel a little bit like the little girl in this picture. And if you've ever heard the expression drinking from a fire hose or drinking from a fire hydrant, you may already feel like that. Right now, when you turn about 64 and a half, you pop up on everybody's radar. Everybody out there that's in this industry knows that you've got certain things on your mind right now, and they all want to get your business. So you're going to start getting a lot of mail. Your mailbox every day is going to have advertisements and solicitations in it from insurance companies, annuity companies, life insurance companies, Medicare supplement plans, Medicare prescription drug plans, Medicare Advantage plans, funeral homes, life insurance companies, and the government. You might get your Medicare card in the mail. Be careful you don't throw that one away. But when you're 6 or 8 months away from your birthday, what do you do with it? You think, well, I'm 6 months away. I don't want to think about that for a while. So you do one or two things. You either throw it away or you set it aside for later. And what happens when you set it aside for later? It starts to pile up, doesn't it? And then all of a sudden you're 2 or 3 months away from your birthday and things become more urgent. You know you've got these decisions to make, and you know that because everybody's talking to you about it. Your family members, your coworkers, your friends, they're all asking you questions and telling you what you ought to be doing. Did you sign up for Medicare? You got to get this plan. You got to do that. Watch out, you're going to pay a penalty. And so what do? You go home, you pull out that pile of junk mail that you've been accumulating, you start to go through it. And folks, if you haven't figured it out yet, it can be a big mess. So my job tonight is to take that pile of mail that you've been accumulating or that you're going to accumulate, and I'm going to sort it out for you. I'm going to sort it out into 4 separate piles. So we're going to talk about original Medicare from the government. We're going to talk about Medicare supplement plans, Medicare prescription drug plans, Part D, and Medicare Advantage plans, also called Medicare Part C. And my goal is at the end of the evening, you can go to your mailbox, pull out that pile of mail, and sort it out for yourself, and then throw at least half of it away. Does that sound good? Great. Let's get started. So we talked about what happens when you turn 64 and a half. What happens when you turn 65? You are now eligible to enroll in Medicare, assuming that you qualify. And the way you qualify is you have to have worked and paid into the Medicare system for at least 40 quarters. That's 40 quarters. Now, a lot of people pay into the system, a lot of people work their whole lives and never pay into the system. The most common are school teachers and school district employees, sometimes policemen and firefighters, some other government employees don't pay in. Now, if you didn't, you're not just out of luck. We can still usually get you Medicare. We just have to do a little extra work. Maybe you're just short a few quarters. Let's say you just worked, 32 quarters paying into the Medicare system. And well, the government doesn't expect you to go back to work for 2 years just to get Medicare. They'll let you just pay for it. So you'll pay a little extra premium and get Medicare that way. Or you can get it through your spouse's benefits, or even an ex-spouse or a deceased spouse. So you're not just out of luck. We just have to do a little extra work on the front end. But for everybody else, you worked your 40 quarters, you paid into the program, and now it's time to get enrolled in Medicare. Now, there's different ways to get enrolled. And the first way is if you are already on Social Security, you are automatically enrolled in Medicare. You don't need to do anything. That's where I say, watch your mailbox. Your Medicare card is just going to show up. And it's very easy to disregard, and some people discard it as junk mail. It comes in a very plain white envelope, and a lot of people mistake it for junk mail and throw it away. That's if you're already on Social Security. I mean, you're getting that Social Security check in your bank account every month. Now, if you're not on Social Security, then you have to enroll yourself. And there's different ways to do that. And the first way is to drive yourself on down to the Social Security office. Wherever you're at, in major cities, there's usually a Social Security office. And what do you think is going to happen when you get there? You're going to wait in line. You're going to wait in line, and you can wait in line for hours. And here's a little insider tip. If you didn't know, the Social Security office closes at noon on Wednesdays. Closes at noon on Wednesdays. So if you're going to go down there, and don't go after noon on Wednesday. And you wait in line for a couple of hours. You get up to the front of the line and you talk to the nice person at the desk, and guess what they're going to tell you? Make an appointment and come back. They do not enroll you in Medicare the first time you show up. You have to have an appointment. But if you do that, you make an appointment, you go, and they can get you enrolled in Medicare. Option number 2 is to call them on the phone. You call the main Social Security switchboard number, and what happens? Well, you wait on hold. And you can wait on hold, folks, for hours. I've been on hold with Social Security for hours. Unless you call on a Monday, you will never get to speak with anyone because they don't answer the phone on Mondays. Now, they will let you wait on hold for about 15 minutes before they clue you into that little fact, but you don't call on Mondays. Don't call on Tuesdays, because that's all the people that called on a Monday trying to get through. If you're going to call them on the phone, call later in the week. Thursday, Friday morning seems to be the optimum time to call the Social Security office. We're usually not on hold more than about 15 or 20 minutes on a Friday morning. But if you get somebody on the phone at the Social Security office, they can get you enrolled in Medicare. Now, option number 3 is to go online to the Social Security website and enroll yourself. Folks, that is very easy. It takes about 5 minutes. In fact, I help people do that in my office every week. We just sit down at my computer, we punch in your information, and you're done. And I'm happy to help you with that. Now, once you're enrolled in Medicare, what does that get you? Well, it gets you Medicare Part A and Medicare Part B. And that's these two right here. Medicare Part A and Medicare Part B. Now, Medicare Part A is your hospital insurance. It pays your room and board in the hospital and hospital services. Now, Medicare Part A, you have already paid for with your payroll deductions all your working life. So there's no further charge for Medicare Part A. You also get Medicare Part B. Now, Medicare Part B is your medical insurance. It pays your doctor bills, or a portion of your doctor bills. It pays a portion of your doctor bills while you're in the hospital and all your office visits and outpatient services outside the hospital. Now, Medicare Part B, you have not yet paid for. So when you enroll, you're going to pay $134 a month. Now, that's as of January 4th, 2018. Now, that goes up and down every year according to what Congress and Medicare dictate. But as of 2018, it's $134 a month. And if you have a very high income, you can pay more. And there's several brackets, and they just changed them up this year. But most people that I deal with, I would say 90% of my clients pay the standard base rate, which is currently $134 a month. Now, that's what you get, folks, Medicare Part A and Medicare Part B. Now, once you have Medicare Part A and B, actually, let me take a step back and talk about how you pay that bill. When you enroll in Medicare, you're going to be billed $134 a month. Now, if you're already on Social Security, well, they're just going to hold that amount right out of your check. So that month that you turn 65, or perhaps even the month after, because Social Security typically pays 1 month behind, your check is going to be short $134 a month. Now, if you're not already on Social Security when you turn 65, they're going to send you a bill in the mail. That's going to be a quarterly bill. It's going to be for 3 months at a time. So 134 times 3 is $402. Once you get that quarterly bill, there's a phone number on the back you can call. You can call Medicare and request that they set that payment up on an automatic monthly banked draft. So that saves you having to remember to send them a big check every 3 months. They can just automatically draft it out of your checking account once per month. Okay, so once you have Medicare Part A and B and you're paying for it, now you have 2 choices. You have 2 choices for how you obtain your coverage. And it's 2 separate routes. It's one or the other. You can't have both. And once you make that decision, based on a couple of different factors, you may not be able to go back. So it's very important that you have a well-informed, wise decision now when you've got the opportunity. Remember, these are 2 separate routes. It's one or the other. And we're going to talk about them separately tonight. And the first one we're going to talk about is the original Medicare route. Okay? And the first thing we need to know is, what does original Medicare from the government do for us? So how does Medicare work? And now I want to just add a little instruction here. We're talking about original Medicare only. If you have original Medicare only, we're not assuming that you have a supplement or an Advantage plan or an employer plan or a retirement plan. This is just original Medicare. So what happens if you go into the hospital for 1 day up to 60 days? Medicare will pay the entire hospital bill after you have satisfied a $1,340 deductible. That is called the Medicare Part A deductible. Folks, I want you to be careful with that one, though. That is not an annual deductible. That is not a That is not a annual deductible. That is per eligibility period. And you can pay this more than once per year. So here's how an eligibility period works. It's 60 days. And the clock starts ticking when you leave the hospital. So let's say you go in the hospital on day 1, and you're in that hospital, say, for example, 5 days. You come out of that hospital on the 5th day. When you leave the hospital, the clock starts ticking on your Medicare eligibility period of 60 days. So if you go back into the hospital on that 61st day or after, guess what? You pay that $1,340 again. So that's not an annual deductible. It's per eligibility period, and you can pay that several times per year. But it pays for the first 60 days in the hospital, so it's not a bad deal if you think about it. 60 days in the hospital, $1,300, not a bad deal. Now, if you need to be in the hospital for more than 60 days, you fall down in here. And now for days 61 to 90, now you're going to pay $335 per day copay out of your pocket for every day that you're in the hospital. $335 copay out of your pocket per day. Now, folks, at day 90, your Medicare benefits technically end. But now you've got what's called your 60 lifetime reserve days. They're called lifetime reserve days because you only get them once in your lifetime. And once you use them, you don't get them back. And when you're in your 60 lifetime reserve days, now you're going to pay $670 per day copay for every day that you're in the hospital for days 91 to 150. $670 per day out of your pocket. And then at day 151, you're out of benefits. Medicare doesn't pay another penny. You are on your own until you leave the hospital. You stay out of the hospital for 60 consecutive days, and it starts all over again. Except now you've used up your 60 lifetime reserve days. So when you get to day 90, you're right back down here. Folks, if you find yourself down here in the red line, well, something pretty bad has happened to you. Something pretty catastrophic. We don't see a lot of people down here, although it does happen from time to time. Most people are going to be up here. Worst case scenario for a lot of people is they're going to pay that $1,340 2 or 3 times a year. But that's just the hospital bill. But what do we know about these things? We get home from the hospital. We get the hospital bill in the mail. What follows shortly after that? The doctor bills. Folks, you're going to get a bill from your surgeon, from your anesthesiologist, from the radiologist. Pretty much anybody that walked past your door while you were in the hospital is likely to send you a bill. Well, those bills are covered under Medicare Part B. And here's how Medicare Part B works. First of all, you pay $134 a month. After that, there is a $183 annual deductible. I'm going to try to write that in with my little pen here. $183 annual deductible. After you've met the annual deductible, then it's just an 80-20 split right down the line. Medicare pays 80% and you pay 20%, with no maximum, by the way. The plans that you're used to up until now have an out-of-pocket maximum. Sometimes it's called a stop-loss amount, somewhere around $10,000 or $15,000 for most plans. But with original Medicare, there is no limit to the amount of money that you can pay out of your pocket. If your bill's $3 million, you're going to pay 20% of $3 million. But other than that, it's pretty cut and dry. $134 a month, $183 a year, 20% after that. But now there's a few different types of doctors we need to talk about. And the first one is a doctor who does not accept Medicare at all. And, you know, we don't really need to worry about those too much because you're just not going to see them. Unless that's your doctor now, you need to find out what's going to happen when you go on to Medicare. They're going to tell you one or two things. Either, yes, you can stay on because you're an established patient. I'm just not taking any new Medicare patients. Or they're going to tell you, no, I'm sorry, I don't do Medicare at all. I know you've been with me 20 years. It was nice knowing you. Here's a referral for the doc down the street. That doesn't happen as often. We do see it from time to time. Most times they'll allow you to stay with them because you're an established patient. But it is nice to know, and that's a question that you're going to have to ask your doctor, hopefully before you turn 65, so we can do some planning. Now, the other two, though, we do need to think about. And the first one of those is a doctor who accepts Medicare assignment. Now, a doctor who accepts Medicare assignment has an agreement with Medicare that says that they will just take what Medicare pays them, the 80%, along with what you pay them, the 20%. And if there's any excess, well, that excess is just written off. You don't get billed for it. Now, you all know what the excess is. You've seen your EOBs, your explanation of benefits from your insurance companies now. It shows this really high amount that the doctor billed, and then the next column in this equally ridiculous low amount that the insurance company approves. And the difference between those two is called the excess amount. So if that doctor accepts Medicare assignment, the excess just goes away. Okay, that's a doctor who accepts Medicare assignment. You pay 20% of the Medicare approved amount. Now, the last one is a doctor who does not accept Medicare assignment. A doctor who does not accept Medicare assignment does not have that agreement with Medicare. So they send the bill to Medicare. Medicare pays 80% of the approved amount. You pay 20% of the approved amount. And if there's any excess, well, that doctor is now allowed to bill you an additional 15% above the Medicare approved amount. That is called the Part B excess charge. So here's an example of how this works. Let's say that your doctor sends you for some outpatient surgery, and you go down to the little outpatient surgical center, and it's outpatient, so it's covered under Medicare Part B. And you get done, and you find out that that outpatient surgery center billed Medicare $12,000 for that surgery. They send that bill to Medicare, and Medicare says, yes, that surgery is approved. However, it's only approved for $10,000. Medicare will immediately pay their share of the bill, 80%, $8,000. You'll pay your share of the bill, 20%, $2,000, for a total of $10,000. But that leaves us with a $2,000 excess, doesn't it? Now, if that doctor or that facility accepts Medicare assignment, that $2,000 excess just goes away. You never hear about it again. You never get billed for it. But if that doctor or that facility does not accept Medicare assignment, they are now allowed to bill you an additional 15% above the Medicare approved amount, which in this case was $10,000. So you paid $2,000 here. Now you're going to get another bill for $1,500 here. Now I realize that still leaves us with a $500 excess, but by law, they're limited to 15%. That's called the Medicare Part B excess charge. And that's an important question for you to ask your doctors. Not only do they accept Medicare, but do they accept assignment or not? Because those last two doctors, folks, they both accept Medicare. One accepts assignment. The other does not. And the other one costs you an additional 15%. So can we agree that with Medicare alone and nothing else, you have a significant out-of-pocket risk? Is that a fair statement? So what do we do to protect ourselves from that risk? Well, we get ourselves a Medicare supplement. And here's how Medicare supplements work. It's a little bit different from the plans you're used to up until now. And the one thing you need to remember, if you don't take away anything else from this presentation tonight, is this. A Medicare supplement's only job is to pay your share of the Medicare bill or a portion thereof. Now, there's a whole bunch of them labeled Plan A through Plan N. And a Plan F is the most common and the most comprehensive. Plan F pays 100% of your share of the Medicare bill. So it pays, if we could go back one slide, it pays the $13.14. It pays the $335 a day. It pays the $670 a day. It pays an additional 365 days if you get down here. It pays the $183, it pays the 20%, it pays the 15%. Excuse me. So what's left for you to pay? Well, zero. So when you go to your family doctor, what's your copay? Zero. You go see your specialist, what's your copay there? Zero. You go to the hospital for an inpatient stay, you spend a few days in the hospital, what's your out-of-pocket cost? Zero. You go for that outpatient surgery that we talked about, what are you putting out of pocket for it? Absolutely nothing. MRIs, CAT scans, tests, x-rays, emergency room visits, urgent care centers, ambulance rides, helicopter rides. You pay nothing out of pocket. Now here's the nice thing about them. Remember, Medicare has to pay first. Medicare's calling the shots. Medicare's setting the prices. And by prices, what I mean, what they pay the doctors. And folks, here's another little tip. 20% of $100 is always $20. So if the bill is $100, Medicare pays $80, your share is $20. It doesn't matter what company is up here, they're paying $20. What that really means to you is that we no longer have to have contracts with doctors. There are no doctor networks, which means that you can see any doctor or any hospital that you choose as long as they accept original Medicare. That's the only requirement. And because there's no networks, you're also not limited to a geographic service area where you have to live and obtain your services. If you have a network type plan now, like an HMO or a PPO, and you want to go get, and you move or travel out of the service area, well, guess what? Your insurance may not work. With Medicare supplements, wherever you travel in the United States, you're covered. They work the same here in Texas as they do in Colorado or Florida or Alaska or Hawaii. And quite a few of them, including the Plan F, have foreign travel coverage, which is not exactly the same as Medicare, but it's better than nothing because original Medicare doesn't pay anything outside the country. But here's the bottom line. Nothing out of pocket. Go to any doctor you want to, any hospital you want to. And the other thing we do not have with Medicare supplements, just like we don't have networks, we also do not have managed care. Now, what that means to you is that with very few exceptions, what the doctor orders is what you get. You see, everything's pre-approved by Medicare in advance in a book called The Schedule of Medicare Approved Procedures. If the doctor wants to know if something's approved, he just goes to his desk and looks it up in the book. And just about everything that's medically necessary is approved. There are some things that are approved on a schedule. Those are mostly preventative screenings. The best example I can give you is a colonoscopy. Most people, if you're over a certain age and you don't have any risk factors, current medical guidelines say that you only need a colonoscopy about every 10 years. Well, that's about as often as Medicare likes to pay for those. Now, if you do have risk factors and the doctor can justify the medical necessity, well, then Medicare will pay for a colonoscopy every 24 months. But they're not going to pay for one in the middle without it being called a diagnostic procedure, and you pay 20%. So they may turn something down as a screening, but it may be approved as a diagnostic. But what you need to remember is that Medicare has to pay first. If Medicare doesn't pay, neither does your supplement. Now, getting back to the managed care part of it, if Medicare approves it, your supplement is obligated by law to pay your share of the bill. The insurance company has no say in the matter. This company pays that doctor the same as this company, and this company pays that doctor the same as this company, and on down the line. So which brings us to one of these frequently asked questions that always comes up in these seminars is, Ron, if it's apples to apples, why would I want to pay more? And these are not the real prices. This is not the real numbers. They're just made up for the presentation today. But the question is, why would I want to pay more? If the coverage is the same, why would I want to go with one that costs more? And that's very simply answered. It's a fair question. It's simply answered. You don't. Under normal circumstances, you want to go with the cheapest good A-rated company. Now, there may be some B-rated companies in the business that are a little bit cheaper. By a little bit, folks, I mean a little bit, a couple of dollars a month, not a lot. But they're B-rated for a reason. We try to avoid those. But as long as it's an A-rated company that has a good long track record in the company where I can see their history, I can see their history of rate increases, I have a history with their customer service, and then I'm going to recommend the cheapest good A-rated company. Here's what you need to know though. Right now, when you're turning 65, you have a window of opportunity from 6 months before your birthday month to 6 months after your birthday, when you can buy a Medicare supplement plan with no health questions asked. No health questions. As long as your check clears the bank, you got it. But once you pass that 6th month after your birthday, if you want to get a new plan or change companies or change plans, you're now subject to medical underwriting. You have to answer a series of health questions, and based on your answers to those questions, you can be declined. So when you come and visit with me, whether you're coming to my office or whether we're doing it over the phone or over Skype or however we meet, I'm going to ask you a bunch of questions about your health. And if I think that you're healthy now and you can expect to be healthy for a few years, well, I'm going to recommend that you start out with the cheapest good A-rated company that's out there. Because if this company goes up on their prices, well, we can just go shopping and get you another one. And that's the other little secret here is that all these rates, folks, they all go up over time. Every year you get a little bit older, every year your insurance goes up a little bit. Some of these companies raise their rates a little more quickly than other ones. And some of these companies, they start out very low in the beginning. They're kind of lowballing you when you're young and healthy to get your business. They tend to raise their rates a little more quickly than companies that start out a little bit higher. They tend to raise their rates a little bit more slowly. So say, for example, and I'm just going to make this number up, so don't hold me to this. In 5 years, this company that was the cheapest when you were turning 65, they've raised their rates 5 times. So they now cost more than this company that wasn't the cheapest when you were turning 65. Now, if you're healthy and you can answer those health questions favorably, well, that's no problem. We'll just go shopping and find you one that's cheaper. But if you're not healthy, then you may be stuck with it paying that higher price. Does that make sense? So when you come to see me, we're going to have a good long talk about your health. And if I feel that you're going to be able to answer those questions 5 years from now, then I'm going to recommend the cheapest good A-rated company. But if you're unhealthy now, or I feel like maybe 5 or 6 years from now, you may not be able to answer those health questions favorably, I may recommend that you start out somewhere over here, because eventually this company is going to cost more than this company. And if your health is taking a turn for the worse, then you may be stuck paying that higher price. And that's my job. That's what I do. I keep track of all these companies and their prices, and I make sure that you have the best company at the best price every single year. And that's Medicare Supplements. Are there any questions about Medicare Supplements? We're running just a little bit behind schedule, just about 2 minutes. We're doing pretty good actually on time. Haven't had a lot of questions. We've got quite a few people on the presentations. I'll just take just a couple of moments here. If you want to type in a question, I'll see if I can get that answered before we move on to the next section. Okay, so that's Medicare Supplements. We're going to move on to the next section, and that is prescriptions. One thing that original Medicare nor Medicare Supplements cover are prescription drugs. That's covered under a separate program called Medicare Part D. Folks, it's called Medicare Part D. It's real easy to remember. Medicare Part D, D for drug. Now, the first thing you need to know about Medicare Part D is that it is optional. You don't have to take Medicare Part D. However, if you don't take it when you're first eligible and you don't already have drug coverage through another source like an employer plan or retirement plan, then later on down the road when you do enroll, you will be assessed a penalty. It's called a late enrollment penalty, and it can be pretty stiff. It adds up. The later you are, the bigger the penalty is. And you don't pay it one time, folks. You pay it every month for the rest of your life. So what I always tell people on this is, even if you don't take any prescriptions, when you're turning 65, just get the cheapest plan. It does two things for you. Number one, it gives you coverage in case something comes up, because you can't get these things in the middle of the year. You have to wait for the annual enrollment period. And number two, it prevents you from paying a penalty later on. But here's how I work with these things. There's a whole bunch of them out there. There's over 20 of them. I don't work for or represent or get paid by any of them. But what I do is I point you in the right direction. So when we get together, you're going to give me a list of your prescriptions, however long or short that may be, and we're going to plug those in to the Medicare website. We're going to plug those into the Medicare website. And you know, it's anonymous. We don't put your name in, but we do put your prescriptions in. And what that website does, excuse me, is it takes all of the plans that are available in your area and it sorts them based on your total out-of-pocket cost for the whole year. Now that includes your monthly premiums for the plan, plus any deductibles that may be required, plus your copays when you go to the pharmacy. It adds all that up and it tells us what's your actual bottom line out of your pocket for the whole year. And then because pretty much all the pharmacies take all of these things, well, we're just going to pick the cheapest one. Now we have to do that process every year because these plans, unlike the Medicare supplement plans that never change, the coverage never changes except for the price. These plans are subject to change every single year, and they can change drastically, and everything about them can change. The monthly premium can change, the deductible can change, the copays can change, the formularies can change, your prescriptions can change. The doctor can put you on something different. And you can only change plans once a year during the annual enrollment period, which runs from October 15th to December 7th. And then the new plans start on January 1st. So here's what typically happens. You get you a Medicare prescription drug plan. October 15th rolls around and I give you a call and I say, hey, it's time to review your drug plan. And what do you tell me? You go, no, Ron, I'm traveling, drug plan worked fine, and it's not broke, don't fix it. Now, what you didn't know, and what I didn't know either, because there's over 20 of these things out there. Each one of them has a formulary book with 1,500 drugs in it. I can't keep up with that. Is that drug that you were taking that was at a tier 2 and you were paying $42? Now, these numbers here, by the way, are made up. These are not the real numbers. That drug you were taking that was at $42 a month on tier 2, that insurance company came back and said, you know, we weren't making a lot of profit on that drug at $42. So next year, we're going to move it to tier 3, and you're going to pay $91 a month for it. Well, plan number 2 over here on the other side, they didn't make that change. So they've still got that drug at tier 2. But now you let that December 7th deadline expire, you're now stuck with this plan for a whole nother year paying a higher price. So if you would have just allowed me to review your prescription list with you, I could have found the best plan for you going forward for the next year. Now, finding the right plan is the hard part. Once you get it, they're pretty cut and dry. You pay us a monthly premium, whatever that is. I don't know until we put your prescriptions into the site. After that, there's an annual deductible, which can be as low as $0 or as high as $405 for this year, 2018. After you've met the deductible, which can be $0, then you pay a copay at the pharmacy. Now, a lot of your generic drugs are going to be very inexpensive, maybe even be free with some of the plans. But as you go up these tiers, well, they get pretty pricey. In fact, they can be downright expensive. As you get into the non-preferred brand and the specialty tiers, they can cost you a lot of money. So it's very important that we review your plan every single year. That's one thing that I do for you free of charge. It doesn't cost you anything if you'll just help me by sending me the information every year when we request it. That's Medicare prescription drug plans, Medicare Part D. That's the hard part about it. You need one, even if you don't take any prescriptions, and I will help you find the right one every single year. Now, we're going to move on, and we're going to do just a little bit of a review. So we've covered the entire original Medicare side of the chart. So we've talked about original Medicare from the government. We've talked about a Medicare supplement plan that pays you out-of-pocket cost up here, and a prescription drug plan that helps out with the prescriptions. Now, this is the side that gives you all the choices. You can go to any doctor or any hospital that you choose as long as they accept original Medicare. That's the only requirement. And when you go, you don't have any out-of-pocket costs because between Medicare and your supplement, depending on the plan you pick down here, they're paying for everything. And this is the plan that gives you no managed care. So what the doctor orders is what you get, with very few exceptions. Now, your other option is Medicare Advantage. This is also called Medicare Part C. And what happens here is, folks, you continue to pay the $134 a month for Medicare Part B. That doesn't go away. You must keep paying that. But now Medicare sends that money over to this private insurance company that you choose, and they combine your coverage and they administer your health care for you, but they take Medicare out of the picture. So now it's just you and the insurance company, and you play by their rules. These are the HMOs and the PPOs. Now, I want to be very clear here. You do not lose Medicare. You're still in the system. But what's happened for that calendar year that you made that choice, Medicare has now contracted you out to this insurance company. They say, here's the money, you take care of them. That's a Medicare Advantage plan. So we'll take a look at what Medicare Advantage plans look like. It's also called Medicare Part C. And what's the first thing you notice about Medicare Advantage plans? We are no longer comparing apples to apples, are we? Every plan from every company can be completely different. Now, the advantage is that in addition to the $134 a month that you are going to continue to pay for Medicare Part B, you will pay little or no additional premium for your plan. Now, again, these numbers are just made up. These are not the real numbers. Quite a few of the HMOs still have a 0 monthly premium, but the PPOs, some of the HMOs and all the PPOs cost money. They can be pretty expensive. Some of the PPOs can cost as much or more than a Medicare supplement. So you have to be careful. Now, where you will pay is when you use the insurance. Now you're back to out-of-pocket costs. You have copays and deductibles and co-insurance. So when you go see your family doctor, well, you're going to have a copay there. Now, a few of the HMOs still have a 0 monthly copay or 0 office copay. Quite a few of the HMOs now have an office copay, and all the PPOs have an office copay. You go see your specialist, you're definitely paying a hefty copay there. You go to the hospital, you're paying either a co-insurance or a per day copay for a certain number of days. You go for an outpatient surgery, you're paying a portion of that bill. All your testing, diagnostics, MRIs, CAT scans, all your blood work, your emergency room visits, your urgent care centers, you're paying a portion of those bills out of your pocket. Now remember, Medicare's out. They said, here's the money, you take care of them. And so now who gets to set the prices that they pay the doctors? The insurance companies do. And this company pays that doctor a little bit less than this one does. And this company pays that doctor a little bit less than this one does. And this company pays it on down the line. Now we have doctor networks. So you all remember what a doctor network is. It's a list of doctors that you can go to. Now, if you have an HMO, that's very strict. You really only can go to their doctors. If you go anywhere else, you're just on your own. They're not paying a penny. Now, the PPOs are a little bit more open. They'll allow you to go to out-of-network doctors, but what do? You pay the out-of-network price, which can be 2 or 3 times the in-network price. And now, because we have networks, we also have a geographic service area where we have to live and obtain our services. If you travel or move out of the service area, well, guess what, folks? Your insurance may not work. Now, the HMOs, some of the HMOs can be very small. They may only cover 1 or 2 counties around where you live. And if you live on the wrong side of the tracks, well, your insurance may not work in the town where you want to go to the doctor. So imagine you've got your family doctor is in your county where your insurance works, but she refers you to a cardiologist in the next town over where your insurance doesn't work. So now what do? You go back to your family doctor and say, Doc, I'm sure that's a great doctor that you just referred me to, but I can't go there because my insurance doesn't work in that county. Please find me another doctor that takes my insurance. Or if you move out of the area, you may have to find new insurance. Or here's one that comes up all the time, pretty often. Unfortunately, it comes up pretty often. A lot of people have to go out of town for things like cancer treatment. You know, we're in Texas, and MD Anderson Hospital in Houston is the premier cancer hospital probably in the country. And a lot of people go there for their cancer treatment. And folks, some of these HMOs, they don't work there. They just don't work. And they may work fine where you live, but they don't work there. So we have networks. Now, the other thing that we have with Medicare Advantage plans is something called managed care. Now, what that means is that the insurance company is making your healthcare decisions for you. Now, they sell it to you like it's a good thing. We're going to manage your care. Don't worry about it. We'll manage your care for you. What are they really managing? They're managing their cost. You see, some of these plans are only getting paid $134 a month, just what you're paying to Medicare. Folks, that doesn't pay the bills. So they have to cut costs. And, you know, to be fair, these companies are in business to make a profit. And one way they cut costs is they don't pay the doctors very much. They pay the doctors less than what original Medicare does, or less than what a group insurance plan does. And another way they cut cost is by saying no a lot. Folks, for anything that's not a life and death emergency or just a regular office visit, you have to get permission from the insurance company first. And they can, and on the Medicare side, often do say no. Now, they're not going to say, no, you can't have that treatment. They're just going to say, no, we're not going to pay for it, which for most of us means what? You can't have it because you can't afford it. That's why you have insurance. And with managed care, now you have to have referrals to go see specialists. Now, some of the PPOs will say, sure, go to any doctor you want to. You don't need a referral. Just tell them to send us the bill. And what's the catch to that? You have to find a doctor who's willing to accept that insurance and pay whatever small amount that they're going to get, accept whatever small amount that they're going to pay them. A lot of doctors are just not willing to do that. So that's two things you've got: networks, managed care. The other thing you have is a one-year contract. These companies have one-year contracts with Medicare, one-year contracts with the doctors, and one-year contracts with you. Any one of those three things changes, and now you're either shopping for a new doctor or shopping for new insurance. Now, you can only change plans once a year during the annual enrollment period from October 15th to December 7th. And once that December 7th deadline passes, you're now stuck with whatever plan you have, or new plan that you pick starting January 1st for the whole next year. So here's what happens. You get a Medicare Advantage plan, and I call you up on October 15th and say, hey, it's time to review your Medicare Advantage plan. You say, no, Ron, it's working fine. I didn't pay anything because you didn't get sick, and I don't have time. I don't want to mess with it. And I say, yep, no problem. What you didn't know, and I didn't either, because there's too many doctors for me to keep track of, is your doctor didn't feel the same way about that plan. Your doctor said, you know, that plan right there, they didn't really pay me very much, and they didn't really pay me on time, and they were kind of a pain to deal with. So next year, I'm not going to take that plan. Now, do you think that that doctor's office is going to pick up the phone and call all of their patients that have that Advantage plan? No, they're not. What they're going to do is they're going to scotch tape a sign to the door that says, as of January 1st, we no longer accept Medicare Advantage plan number 1. Now, if you walk through the door during that time, you can get the message and call me, and we can find you a plan that your doctor does take. But if you don't get the message, when are you going to find out about it? You're going to show up for your physical in May, and you're going to show them your insurance card, and the lady on the other side of the counter is going to go, oh, no, I'm sorry. We stopped accepting that insurance back in January. You're now locked into it for the whole year, and so now what do? You either pay cash out of your pocket for something that should be free under that insurance plan, or you go find a new doctor. And who wants to do either one of those two things? Now, there's some good things about these plans. There's some semi-redeeming factors. Number one, they do limit your out-of-pocket costs. Remember, with original Medicare, there's no limit. With these plans, it varies depending on the plan that you pick. There's going to be somewhere between about a $4,000 and $7,000 out-of-pocket maximum, annual out-of-pocket maximum. Some of the plans do still provide the prescription drug coverage. Some of them don't, though, so you have to be careful. Make sure you understand what you're getting into. Some of them still do provide some very basic dental and vision services. So you might get one teeth cleaning a year and one pair of glasses every other year. You're not going to get any kind of major dental coverage, though. It's just really just a cleaning. And some of them still do offer that free health club membership. If you've ever heard your friends talking about silver sneakers, that's what that is. It gets you a membership to a local health club for free. Be sure you understand the value in that silver sneakers. This is the conversation that I have with people. What's the value? How much does a health club membership cost? On the high end, you've got places like Gold's Gym, probably around $40 to $50 a month. On the low end, you've got Planet Fitness, that's $10 a month. And for senior citizens, There's no contracts, no sign-up fees. It's $10 a month, month to month. So you've got a $120 a year value out of silver sneakers and a $7,000 bill if you get sick. So let's weigh the costs and the benefits of these plans. So these plans are right for two types of people, in my opinion. And the first one is the person that comes into my office or is chatting with me on the phone or Skype. And he says, Ron, I haven't been to the doctor in 30 years and I don't plan on going back anytime soon. And I don't want to pay for one of those Medicare supplements, so I'm just going to get that free HMO. And you know, I've got some money in the bank, so I don't mind taking the risk with that out-of-pocket cost. You know, it's not going to change my life to write a $7,000 check. And I don't have a doctor. He died 20 years ago, so I don't care what doctor they send me to if I do have to go. Well, Medicare Advantage might be right for that person. And then the other one is a person who simply just cannot afford any further monthly bills. And that's okay. If you can't afford it, you can't afford it. It's better than nothing. It's better than nothing, because to take the risk with Medicare alone and nothing else is it's just too risky. This is better than nothing. But because you can't afford anything else, you're going to be forced to take that risk with that out-of-pocket cost. You're going to be forced to give up your choices of doctors and hospitals. And you're going to be forced to give up your control with your healthcare decision making. That's what it boils down to for a lot of people that I work with. Who's in control? Who's making your healthcare decisions? You and your doctors, or the accountants at the insurance company? That's Medicare Advantage plans. Are there any questions on that before we move on? So that kind of brings us towards the end of the presentation. We have covered the entire chart here. This is the original Medicare side of the chart where you get all the choices. You get an original Medicare A and B, you keep those. And then you get a Medicare supplement plan, also called Medigap, that pays your out-of-pocket cost up here. And a prescription drug plan to help out with the prescriptions. Now this is a side that gives you all the choices. So you can go to any doctor or any hospital that you choose as long as they accept original Medicare. And when you go, you have little or no out-of-pocket cost, depending on the plan that you pick. And you have no managed care. So for almost everything, what the doctor orders is what you get. You don't have to get permission from the insurance company first. Your other choice is Medicare Advantage. Now what happens here is for that calendar year, you've relinquished your Medicare benefits. You've chosen to be contracted out to this insurance company, and they're going to take care of you for that year. But for that year, Medicare, original Medicare, the government is out of the picture. So what happens here is you pay a little bit less per month, but what do you do in exchange for that? You take on a much greater out-of-pocket risk. You give up your choices of doctors and hospitals, and you give up your control with your healthcare decision making. So it's a tough choice sometimes, but I'm here to help you with that choice. And remember, once you make that choice, you may not be able to go back, because if you pick a Medicare Advantage plan, some people will come into my office and they will say, Ron, I'm healthy now. I'm just going to get one of these Medicare Advantage plans, one of the free HMOs. And if I get sick, then I'll just go get a Medicare supplement. Well, folks, it doesn't work like that. Once you're sick, you may not be able to get a Medicare supplement, and you may be stuck with that HMO that's not paying for your treatments. So it's very important that you make a wise decision now when you've got the opportunity, because once you have the Medicare Advantage plan, you may not be able to go back to the original Medicare side and get a Medicare supplement. So here's one of the other big questions that may come up. What if you're still working? If you're still working and you have company insurance, or you're retired and you have a retirement plan from your company, you've got some questions that you need answered. And I can't answer those questions for you. And the insurance company can't answer them either usually, so don't bother calling them. It's your human resources people, your benefits people at your company. And the first one is, can I keep my insurance? Sometimes the answer is yes, nothing changes, you can keep your insurance. Sometimes the answer is no, you're out. Sometimes the answer is no, you're out, but we're going to give you some money to go out and buy your own insurance. Once you get the answer to that, if the answer is no, well, you know what to do. Give me a call. If the answer is yes, then you have two more questions. And the first one is, will I be required to have Medicare Part B? Sometimes the easier way to ask that question will be, who will be primary? If your company insurance is going to remain the primary and Medicare is going to be the secondary, then you probably don't have to have Medicare Part B and therefore not pay for it. But if your company insurance is going to revert to being the secondary and Medicare is going to be your primary, then you probably do have to have Medicare Part B and therefore, of course, pay for it. And then your last question is, how much is it going to cost me? Your premium for your insurance can change. It can go up, it can go down, it can stay the same, it may be zero. Once you have the answers to those questions, give me a call. We'll compare them side by side. I'll put it down on paper. What does your company plan cost and what are the benefits versus what does my plan cost and what are the benefits? And you just pick the one that makes the most sense to you. Just let the math speak for itself. That's if you're still working. Now, what are the benefits of working with me, Ron Ray, as your advisor? Well, number one is, folks, I work for you. I'm an independent broker. I represent all the major insurance companies that do business here in this state and in the other states that I'm licensed in. And what that means is that I owe allegiance to no one insurance company. They all pay me. They all pay me about the same. So it doesn't matter to me what plan you pick as long as it's right for you. And along those lines comes our next point there, personalized service. There are no cookie cutters in my office. When you come to see me, we're going to have a good long conversation about your health and about a few other things. And then I'm going to make a good, suitable recommendation to you based on your specific needs. And the idea is everybody on this webinar tonight can get a different recommendation because everybody has a different situation. Number three, I want to be your trusted advisor. I want to be the person that you call when you need something. I don't want you to have to pick up the phone and call the 800 number for the insurance company just to wait on hold for 20 minutes, just to speak to somebody in some foreign country who doesn't care about you, who is just trying to hurry up and get you off the line to get to their next call to meet their quota for that day. Folks, let me do that for you. Next, you're going to get a free review every year. Every year, or as often as you like, we'll get together and we'll talk about how things are going. We'll review your Medicare supplement plan, make sure you've got the best priced plan with the best benefits for you every single year. We'll review your drug plan during the annual enrollment period, which is October 15th and December 7th, to make sure you've got the best plan for the upcoming year. Anything else you want to talk about during that review, it doesn't cost you a penny. And we're just trying to save you money. Next, it's not just me. I own the company, but I have a full-time staff here in my office. I've got 4 offices around the South and Central Texas area. I'm licensed in several different states and do business in them as well. But I also have this team of experts that I work with in the areas of tax planning and estate planning and legal elder law issues. So my CPA specializes in folks like you who are retired and have special concerns about medical cost deductions and your retirement taxes. We want to be sure that you're not paying too much in taxes in your retirement. And then my attorney also specializes in estate planning. So he does all your wills and trusts and powers of attorney and medical directives for my clients for a very special price, as well as the CPA work for a special price as well. That's my team of experts. Several times a year, we'll hold a client appreciation event. So if you're local here within driving distance of New Braunfels or San Antonio, Texas, or Austin, Texas, or Round Rock, we have a party, just a little get together. There's no kind of sales pitch involved. It's just me saying thank you. A little bit harder if you're in a different state to come down for a client appreciation event, but we do these things for you. last but not least, you never pay 1 penny for my insurance services. Now, you may be thinking, well, Ron, I buy insurance from you, and I pay the premiums on that insurance, and the insurance company pays you, so therefore I'm paying you. You know, that's a fair statement. I accept that, but here's what you need to know. You don't have to go through an agent to buy insurance. You can call any of these companies up directly and get the insurance directly from them. But the prices are regulated and monitored by the state of Texas, and nobody can discount them, not even the companies, not without permission from the state. So what that means is that you call that insurance company up directly, you pay the same price, but you don't get me. So now who's waiting on that 800 number? That's you. And the fact is, I've got the secret 800 number, so don't wait on hold anyway, but I'm not giving that to any of you people. I'm happy to help you. It doesn't cost you a penny. Now, I am a fee-based financial advisor, a licensed fiduciary. I'm the money guy. I'm the one that protects your assets in retirement, making sure that you have enough money to last you the rest of your life and have some to leave on to your kids and grandkids and your heirs and beneficiaries. So that's what I do. Folks, if you'd like to work with me, if you'd like to meet with me to go over your specific case, here's the next step. What I want you to do is call my office tomorrow or send us an email. You can do that right now. Don't close this screen just yet because the webinar will end for you. But give us a call. It's 830-217-6711. The toll-free number is 800-515-4031. Shoot us an email. Amanda is my assistant appointment setter. She will take care of you. You can email me directly. Visit our website. Also, there's lots of helpful information on there. It's called T65S.com. That stands for Turning 65 Solutions. You want to do this, folks, no later than about 2 months before your birthday. Remember, your Medicare benefits go into effect on the first day of your birthday month, not on your birthday. Unless your birthday is on the first and it's the first day of the month before. So if your birthday is on March 15th, your Medicare benefits go into effect on March 1st. The very latest that you want to wait is about 2 months before. So you would actually want to get started right about now, January 1st. I know from experience that it takes about 8 weeks from the time we submit an application, it's processed, printed, approved, and mailed so that you have your insurance card in your hand ready to go when your benefits go into effect. So the very latest that you want to wait is about 2 months before. You can get started much earlier, as early as 6 months, but the very latest you want to wait is about 2 months before your birthday. Folks, that's all I have. I really appreciate you spending some time with us tonight. You've been a very nice crowd. I think I've answered most of your questions. If you have any other questions, or you want to talk about specifics or talk about your case or ask me any other questions you want to ask, give me a call. But you can always send us an email. Check us out on the web. Again, my name's Ron Ray. I really appreciate your time and hope to hear from you soon. Thanks, folks.